Welcome to Sex and Intimacy After Cancer. My name is Savannah Shine. I'm the Ovarian Cancer Program Director. And with me here is Christine Benjamin, the Breast Cancer Program Director, and Andrea Herzberg, the Helpline Coordinator for the Ovarian Program. Before the presentation begins, I'd like to tell you a little about SHARE. It's a 36-year-old nonprofit organization. We help people through breast or ovarian cancer, offering a unique support of survivors who've been there. Our services are free and include helplines, support groups, educational programs, and public health initiatives. For more information, visit our website at sharecancersupport.org. Let me tell you about the format of the program and how you can participate. We're going to start the program with the presentation by Dr. Mindy Schiffman. We're going to ask you to hold all your questions and comments till the end. Anyone participating by webinar can feel free to submit questions or comments through the question panel on your control panel, but we're not going to get them until after the presentation. You can access the question panel by clicking on the red arrow in the upper right corner of the screen. Once the presentation is over, we'll open it up for questions. And if you have a question, you can type it in the space provided on your control panel, and that will effectively raise your hand by clicking on the hand icon, also in your control panel. I'd like to introduce our speaker now, she's not a man. Dr. Mindy Schiffman. She's a clinical psychologist and sex therapist at NYU Fertility Center. She's a clinical instructor at the Department of Obstetrics and Gynecology at NYU. She also has a private practice, and we're very glad to have her here today to speak about sex and intimacy after cancer.
Well, thank you very much for inviting me today. It's good to see a few of you here, and it's nice to know that there are a number of you who are lurking on the web. Since survival rates of gynecologic cancers have improved, you can now look beyond just surviving cancer to getting back to improving the quality of your life. Sex and intimacy, of course, are among the most important aspects of our lives. And that you are all here tonight, online or in person, is a testament to your resilience and determination to be healthy survivors of cancer. So my goal in this talk tonight is to open your eyes to ways to improve and enhance your sex life after cancer. I'm just trying to change the panel here.
And there's some construction noise, too.
Sorry.
Sorry, give us 1 second. We're having a technical difficulty.
If you, okay, let's see.
Oh, I see.
Okay,
remember that.
There we are. So let's move this. No, stop.
Okay.
There, got it. Good.
Okay. Yeah.
So now, we lost it. Okay, there we go. So, this is where I'm going to ask you all to jump in if you can. What makes sex satisfying? Throw out anything. To you, what makes sex satisfying?
Orgasm.
Okay. What else?
Penetration.
Okay. What else?
Connection.
Connection.
Intimacy.
Intimacy. What else?
And webinar audience, feel free to type some stuff in. I'll read it for you.
So the things that the things that you're bringing up, though, orgasm, penetration, connection, intimacy, these are all aspects of a good sex life, okay? And they have to do, what we're talking about here are things that have to do with our bodies, our minds, but there's also the setting that plays a part as well. So when we talk about our bodies, we're talking about the outside of our bodies, but we're also talking about what goes on inside, the hormones, the neurotransmitters, those are going on also. And in our mind, we're talking about what we bring to a situation, both from the historical past and also what the current experience and emotions are. And the setting, when we talk about the setting, we're talking about our partners, but also the specific surroundings at that moment, okay? A romantic setting might be very different from a setting that might be a little bit more risky somewhere, okay? So you've got different kinds of situations that bring up different things. And all of these things have to work together in some way to have a good sex life. So after cancer, there are real changes in your body. There are surgical changes, there are hormonal changes, chemical, and there may be neuropathic changes as well, especially if you've had chemotherapy or postmenopause. So there can be real physical changes. There are obviously changes in your emotions after cancer as well that you're going to bring to the situation, and there may be changes in the setting, for example, your partner's reaction. So it's normal to have a lapse in your sexual interest, sexual activity, or satisfaction after cancer. And that's important for you and your partner to know so that you're not misattributing changes in your responsiveness to something having to do with the relationship, because it might not be there. It may be actually physical, okay, or actually having to do with changes that are going on. Just for you all to know, the most at risk for major physiological changes are the women who become suddenly menopausal, okay? So surgical menopause or chemical menopause will have a much more dramatic effect on your physiological changes, that's the hot flashes and everything else that might go along, than it would if you went into a natural menopause. Okay. So what are the most common sexual problems for women who've had breast or ovarian cancer? A lowered self and body image, decreased desire, pain with penetration, usually due to decreased lubrication, and for women who've had ovarian cancer, orgasmic issues, having problems coming, is not uncommon. Okay? After removing the ovaries or through chemotherapy, you can go into a premature menopause, and that can cause vaginal dryness, hot flashes, weight gain, fatigue, and all of these things are going to contribute to problems with your self-image as well as desire, penetration, and orgasmic issues, potentially. So more specifically, what are the changes in the self and the body? So you all know this only too well. Changes to your body. There have been actual losses, a uterus, a breast, scarring, reconstruction, weight gain or weight loss, changes in your hair, in the thickness of it or the amount of it or the color, the texture. Your actual sexual responsiveness, you may have noticed a change. If you're of childbearing age, there may be fertility issues that have come up. Role changes. So you may have been the breadwinner before or the main caretaker, and now you're the patient being taken care of. Maybe you've had to take a leave of work. So there are changes in your role with your partner, within your family, at work, and there are the bigger issues, maybe bigger issues, the existential issues, life and death concerns, reassessing your goals and your purpose in life. These are obviously have an impact. So how you feel about yourself has an enormous impact on your arousal and on your sexuality. When we talk about desire and arousal, they're actually very related. So what is desire? It's just an interest in being sexual. Libido is another term for it. Horniness is another term for it. Arousal is a different thing. Arousal is what happens in terms of when you actually are sexual. How do you respond? How excited do you get during a sexual experience? How lubricated do you get? Those have to do with arousal issues. Okay? So most people seem to go into a sexual interaction because they desire to have sex, then they get aroused. Okay? After cancer, but also in other situations like very long-term relationships, sometimes desire doesn't start things. Arousal can sometimes lead to desire. So what I tell people after they've had cancer is not to wait till you're in the mood. Be open to the possibility of sex, because sometimes once you get started being sexual and get aroused, then you can feel desire afterwards. Okay? So a lot of people are waiting, desire first, then arousal, but the other way works also. Okay, I like to think of Bonnie Raitt's song Love Letter. In the chorus she sings, look comes to push, push comes to shove, shove comes to touch, and then touch will come to love. So think about that. If you touch first, that may lead to love. So how do you improve desire in the bedroom, outside the bedroom? Sorry. Well, first you have to take care of your self-image. If you feel badly about yourself, it's not going to help. So you have to take care of yourself, whatever that means. Some things that you can do to take care of yourself are to exercise, attend to your wardrobe, attend to your hair, get a wig if necessary, put on some makeup, go for a massage, do things, or, to a spa, do things that make you feel good about yourself. You can also do things in relation to a partner before you're in the bedroom that can improve desire. These are promoting activities out of the bedroom that increase desire, what I call dating-like behaviors. Send each other love notes, hold hands, try deep kissing again. Go out dancing. Do activities together. Have a romantic dinner. Cuddle. Do something athletic. These things will improve and promote your desire in the bedroom. So here's where there's another major change that has to happen. You have to change your goal. The goal can't be just for orgasm. It has to be for pleasure. You touch for pleasure, not for orgasm. It takes the pressure off, and it allows for you to be more open to what's going on at the time. The other thing that can happen when after cancer is that you have a lot of negative thoughts. I'm not going to be found attractive. I'm not going to get aroused. What is he or she thinking about my scar or my mastectomy? Am I still lovable? This isn't working. These kinds of ruminating thoughts are negative sexual thoughts, anti-sexual thoughts. So you have to counter the anti-sexual thoughts with sexual thoughts and fantasies or erotica. And you can read things before you're in bed, read something or watch a video, or just bring a fantasy to mind. The other thing that you need to use after a diagnosis of cancer is lubrication. Okay? You don't want to start worrying that you're not lubricating and, oh my God, I'm not lubricating. That means I must not be very turned on. Okay? You're not even giving yourself a chance. You're not lubricating possibly because you've had chemotherapy, you're perimenopausal or you're menopausal, postmenopausal, and you're not lubricating, and so now you have to supplement. Lubrication should be water-based and non-glycerin, and it should be used liberally all the time. They have great lubrications now that don't feel very different, okay, don't taste very different. Okay, this is not a legible slide, but I put this in here for you to take home and take a look at it. And this is the kind of thing that the kind of discussion I might have with the couple or a woman who comes in and says, okay, so how do I get past the mastectomy? And one of the big aspects of working with this is to do something called sensate focus with patients, with people that have had trouble getting back to being sexual again. These are unpressured sexual interludes, usually beginning, they're just touch exercises basically between two partners to help them to relearn one another's bodies and to get comfortable again with touching, with no pressure, no expectation, no anything. Just let's touch one another again and see what happens. What feels good, what doesn't feel good, what hurts, what doesn't hurt, what works, what doesn't work. So you usually start non-genitally and then move to genital touching. Sorry for the background noise. Okay, so so this is the kind of exercise that I might give somebody and their partner if I were seeing them. So the other problem after after cancer treatment is pain during intercourse, painful penetration, and you have to stop having painful intercourse. Even one really painful intercourse can make the next time more painful, because as soon as you've had a painful experience, you're going to pull back, tighten up, and the next time it's likely that you'll be in pain again because you are not relaxed. So instead, just until you're able to be penetrated without pain, you should have what I call non-penetrating sex, manual or oral stimulation, and relearn pleasure without pain. And then you have to learn how to have, how to allow for penetration. And the way that you can do this is through the use of Kegel exercises. So what is a Kegel exercise or a Kegel exercise? It's just the entrance to your vagina is called the introitus, and it's a muscle. And when you are tense, that muscle gets really tight. And what a Kegel does is for you to teach yourself what it is to be tight and what it is to be relaxed. Okay? So it's the same muscle that you would use if you were trying to stop urine from flowing midstream. Okay? So if you all right now practice a Kegel, okay? Tighten now like you were trying to stop and hold it for about 5 seconds. And then release, really relax, okay? Nothing should enter you unless you're in that relaxed position. So what the Kegels do is just teach you really the vast difference between being tight and being relaxed, okay? If you can't, with lubrication, put a finger easily in so that it doesn't hurt, okay? Or try 2 fingers easily in so that it doesn't hurt. Then you have to back up and maybe think about starting to learn to use a dilator. So this is taking back control over having anything entering you. And these are dilators, okay? For those of you online, you can't see this, but they're dildo-like things in graduated sizes, and they come smaller and larger. They start about the size of a pinky and work up to penis size and something a little larger than that. But what you do is you start with the smallest dilator that you can easily put in when you're in the relaxed Kegel position with lots of lube. Okay? So you tighten, relax, tighten, relax, tighten, relax, and then push the dilator in. If it hurts, go to a smaller dilator or more lube, or try relaxing. Okay, you can do this on your back with your feet bent as you would be perhaps through missionary-style intercourse. Okay, that's the most relaxed position, so you don't have a lot of tension. And then as you learn to use the larger and larger dilators, then the partner gets introduced, and you put him inside of you. Okay, you take him and put him inside of you. He doesn't go inside of you. And this is a way for you to learn that you can have penetrative sex without it hurting, okay? It's very important that you not have sex that hurts if you don't want to. Okay, so the other problem is we try and go away from the idea of goal-oriented sex for orgasm, but orgasms are also important, so I don't want to leave those out. The orgasms may change, especially after chemotherapy, and there may be some neuropathic reasons for this, where the ends of your like your fingers and your clitoris are actually affected by the chemo, okay? So neuropathy is when there's numbness or pain. So that may actually affect your clitoris, and it may make it harder for you to come. So you're going to have to practice seeing what works. Again, always use lube. Try self-stimulation and see what works. Teach your partner what works then. If nothing is working, you might need to try a vibrator, so that's taking it to another level. And there are vibrators that some are stronger than others. And so it's not that you should put the vibrator on right away. There has to be some stimulation so that you're excited, and then get to a point where you then add the vibrator. So you're slowly trying to improve that. But some of that practicing shouldn't be done in the context of an intimate sexual experience because it's too clinical. So that's why I say try some of this stuff on your own, outside the bedroom, where you're not interfering with some of the romance and the setting situation that's also going to enhance the desire and the arousal, okay? So obviously, after cancer, there's an impact on the relationship and an impact on the sexuality within the relationship. Survivorship may have become a defining part of you. Your longer-term partners may feel similarly or different, and this could affect your relationship. Your partner, may also be reacting to changes in your body or in your role in your relationship to him or to her, and they may be reacting to different things than you're reacting to. So the partner also has to work at getting back their passion so that they're not focusing just on the cancer and the reminders of the cancer and the losses during the sexual interaction. This obviously can have a very variable reaction depending on whether your partner is very sensitive or attentive to you, what your partner's level of sexuality and sensuality is, how open your partner is, and how able the two of you are to communicate with one another. Interestingly enough, for those of you who are working to get into new relationships, in new relationships, new partners are not feeling the same loss that you are. They are still coming into this relationship as you are. They haven't known you any other way. And so their sexual interest in you and the novelty and lust that they may feel towards you and you towards them is usually not as bad as with the longer-term partners who are obviously have a very different, the cancer has a very different impact on them. So it's not as much of an issue. The sexual interest is not as much of an issue with new relationships, although going into a new relationship you may have more worries about fears of rejection or questioning if you're lovable. The partner may be worrying about your cancer status, how well you're doing. You may have questions about when to tell and how to tell a partner, and certainly the first time that you have a sexual experience with a new partner can be very anxiety-provoking, not just before cancer, but also after cancer, and maybe more so. So these are obviously issues that need to be worked through. Most of you won't be able to go on hormone replacement for hot flashes or for the dryness from the menopausal symptoms. But there are some medications now. Some doctors are using SSRIs, which are antidepressant, anti-anxiety medications to decrease menopausal symptoms, and you can ask your doctor about that. There are some medications that may be helpful with libido. It's not really clear. Women's libido seems to be a very complicated matter, and just giving them Cialis does not seem to help. So that may be questionable. But again, things are worth trying. You never know. You can talk to your doctor about that. So, a few take-home messages is that, you need to communicate your wishes, desires, and concerns out of the bedroom beforehand, and then let your partner know how things are going during the interaction. You should lower your expectations for any given sexual interaction. And by that, what I mean is, don't have an end point in mind. Say yes to the possibility of a sensual or sexual touch. Don't wait to be in the mood. Be pleasure-oriented, not goal-oriented, and be sure your partner knows what pleases you. Start with what works. Avoid pain or times when you're really exhausted. Don't forget dating-like behaviors, affection, remember kisses. These are times outside the bedroom, kind of a foreplay that will enhance desire and then lead to more arousal. Make sure you attend to the non-affected parts and not just the erogenous zones. If things aren't working, consider those unpressured sensate-focused interludes where there's no real expectation, just for the two of you to relearn what you both like and are comfortable with. And then once things are working a little bit, be a little experimental. Try things out on your own. Consider masturbating. Consider alternate positions, erotica, videos, sex toys, vibrators, and don't forget the lube. Okay? Try to maintain a sense of humor. Don't give up on sex. Get help. Here's some resources for you. Thanks. So, questions. I guess we'll take questions from the audience out in space and here as well.
So here's a question. I've never had to use lube before, and I have no idea how to use it without breaking the mood.
Excuse me. Sorry. So there are two things that you can do. There are vaginal moisturizers. Sorry. Vaginal moisturizers. One of them is called Replens, and you can use those before you're sexual, and that will keep you kind of moist even when you're not being sexual. Then, once you start being sexual, it's important to have the lube by the side of the bed. Don't keep it far away where you have to jump out of bed and run to the bathroom to go get the lube, or to some drawer where you've hidden it. Put it out somewhere that's easy to make access to, and you will probably have to talk to your partner about it, that because of the cancer, because of the menopause, you may need to use some lube. It's nothing personal, so that your partner is aware that this doesn't mean anything about your partner that you're needing to use lube.
You have to get him involved also.
You do. That's right. You have to get your partner involved. Other questions, concerns, worries?
Someone wrote in, there's no way I can feel sensual without nipples. my sexuality has been destroyed. I don't think my marriage is sustainable without his having breasts to enjoy.
So this is a very big loss for a lot of women who've had breast cancer, is to lose the sensitivity of their nipples. And so this is a good example where doing the sensate focus is really important, which is to find other things that are also exciting and that provide sensitivity during sex. So if you think about things other than the clitoris or the nipples that are arousing to you if touched softly or in certain ways. So some people think their neck is very sensitive, behind their ears, in the soft parts of their arm, behind their knees, okay? So there are other places that are very sensitive and can be aroused during a sexual interaction. So some of it has to do with being willing to try other things, coming to terms with the loss of the nipples, which you may never have that particular, I mean, you will never have that particular sensation again. So that's a real loss, but there are other ways to enjoy your sexuality, and that's what we're trying to move towards, accepting that there are changes, but you can still have a good sex life without that. Obviously, the partner has to be willing to work on these issues as well.
So someone is saying that they don't have a partner to work with, and her problem is not being able to even fathom getting involved with someone after mastectomy.
So, believe it or not, most men are not getting involved with you because of a breast or two breasts. There's even men, okay, are interested in you as a person. You are not your breasts. You are not your uteruses. You are not your ovaries. You are you. You are a whole person, and those are only parts of you. And there are many men who, of course, will be disappointed to know that you're not going to get pleasure from them touching your breasts. But they're not getting involved with you because you have breasts or you don't have breasts. So it does have something to do with picking somebody who's interested in you for you. Your sexuality is not just your breasts. It's your whole body. So that's why we talk about these sensate focus, is to reconnect with the other parts of your body that are also sensual, sensitive parts. Your skin is incredibly sensitive, all parts of your skin. Anybody ever kiss your toes? Think about it. It's pretty sexy, right? Right? That's weird if we think about it, and then you say, no, that's really nice. So it's not just about the nipples or the breasts. And men, there are many good men who can look past that. A good partner is not easy to find, though, under any circumstances. You do have to look hard.
Someone is saying, I have too much shame to have him work on these issues. If he knew how deeply compromised I am, I don't think he could handle it.
So a little therapy goes a long way. There are group sessions, wonderful sessions that share, and other organizations can help you to deal with if you can't find or don't have a private therapist to work on those issues. It's not uncommon to feel shame, but you didn't do anything. This this was a cancer that was brought on you. And so it's sad, and it has an, a forever impact on your life. But to feel shame about it is really to take on a whole nother level of pain and self-abuse that's not going to help. So I really urge people that are dealing with deep shame to go get help so that you can move beyond that. Anybody here, can anybody here share anything about being able to move beyond that, or ways in which you've been able to move past difficulties in your sexual experiences?
I think I'm going through a difficult time because, well, not only from what happened with my breast cancer, but I have a history of sexual abuse, so like everything kind of comes back. So I just started looking for a therapist, which is not easy either.
Right, right. So we're talking about there are layers of situations. You know, your sexual history plays a big role in how you're going to respond now. And so if you haven't dealt with those issues completely, or they're coming back because of what you've been through, then you have to revisit them and work through them. But you can. I'm sure I can give you a referral. What about the staff here? Anybody have any questions or things that you've heard from other people?
I'm usually so gregarious, but I tell you, I wanted to watch the archive or listen to the archive with my husband, and I'm afraid to say anything. It's very personal. But I will say this. I was in surgical menopause at age 39, and I'm 58 now. So, over the courses of the years, I don't let the subject die. I mean, I'm always talking to my oncologist, my gynec, and my breast specialist. And, there are small hormone creams, small amounts. They're comfortable with that. They don't,
Some are.
Some are, and sometimes, it's up to you if you want to, I'm getting ready to kind of take a little bit more of a risk and do a double thing, small amounts. Just, and for no other reason than the libido issue. So that blows me out of the way for ever listening to this. But I think it's an important thing, and I think a lot of the suggestions are great suggestions.
So one thing is that it's hard to get started with these topics with a partner. And one way that people can do this, is when you're not looking at one another, but you are in the same place together. So if you're having trouble speaking face to face, try bringing up these issues in the car, or if you run together when you're running next to one another, or riding a bike, have a conversation where you don't actually have to do eye-to-eye contact. It breaks the ice, and then as you start to talk about sex, it gets easier over time. It's always hard in the beginning, but once you start, it gets a little bit easier. And it's an ongoing process. People have this idea that the only good sex is if you never have to say anything, that the other person should be able to read your mind and know what you like and what you want and what you're experiencing. And, women are a lot more complicated by men, okay? That erection that men get makes it a little bit easier for you to read how they're doing than it does for the men to read you, or for the women to read you. So, but even men will tell you just having an erection is not enough for them either, for many men. So start the conversation. It doesn't have to be the first and last time that you'll have it. It shouldn't only be a one-time conversation. It's embarrassing for everybody in the beginning. It's hard. So start with that. So say, I have something embarrassing and hard to talk to you about. I'm nervous to talk to you. Most partners will reach out and say, tell me. I want to know what's going on. Look away if you have to. Use the internet. Can we talk?
Text one.
Do they have any, I mean, I'm not sure if I've heard you say is if it's legitimate, you know. Like for men, see, I think they have a strong point of making sure men, and maybe it's because it's a man's world, or men are in charge of the drug companies or whatever, like, because you have like Viagra. Men, they just kicked us to the, I mean, in other words, as long as they get theirs, what about us? Is there something that you are aware of down the line, or just?
So there has been some research that's been attempted on testosterone patches for women and some of these drugs that are Viagra-like for women. And the problem is that they don't work consistently enough for everyone for the drug companies to agree to continue with them. So they work for some women some of the time, or maybe there's some special subset that they haven't figured out, but they've done some research and it doesn't work as consistently for all women or for enough women. And so that's why I say we're complicated. We're more complicated. Setting matters more to most women than it does to most men. Okay? So we have to know that we like to be in a place either for, you know, depending on what your preferences are, that you like to be with somebody that you feel safe with or that you feel comfortable with. Or maybe you're somebody that likes a riskier setting, but you know what works for you and what doesn't. For a lot of men, it's a lot easier for them. Their reactions are different. Now, they have their own issues after cancer, and believe me, Viagra alone is not helping them either. So, it's not, one pill doesn't fix everything. You still have to be able to talk to your partner. You still have to try new things. You still have to test the waters and see what works and what doesn't work.
Can you speak to having this conversation that can be difficult for somebody even like your partner, but then again with your doctor? Because, I mean, I'm not a cancer survivor, but I have another chronic reproductive health condition that also basically has the same issues, has me experience similar issues, and I cannot, and I am a pretty, powerful advocate with a strong voice, and I still run into doctors just saying, I will, repeat my symptoms or express my issues, and they will say, yeah, I'm not really sure. I mean, it's amazing how many brick walls I keep hitting, even with sort of more, I think, progressive or open-minded physicians.
So, physicians have studied physicians in regard to talking about sexuality, and if you talk to cancer doctors, most of them will say they know that their patients are going to have sexual issues, and only about, I think it's something like 25% of them or fewer will actually talk to you about it. So the problem is the doctors are people, and we're all pretty nervous and embarrassed about talking about our sexuality or talking about sexuality. Many doctors also don't feel that they have the time to sit and talk about it with you and don't really know enough about what to do about it other than throw a pill or throw a lubricant or, throw a moisturizer at you, a vaginal moisturizer. So it's important to find out if your doctor has any referrals for you, because there are sex therapists around that can help, and that will be able to help you to find the other people that could help you. There are lots of specialists in the area, but you really need to go to a specialist often. Doctors are not always that comfortable talking about sex either.
So someone online is having some difficulty accepting what you said earlier about men don't want you for your breasts. She believes that every man wants a woman with 2 breasts. And she's asking, is there any way to hear from men and hear them say that they don't care so much?
Has anybody here had breast cancer and still with a male partner?
Me.
You are?
Yeah. I got a husband, and I'm still with him. And, I mean, I'm not saying my life is perfect, but it's not necessarily, in other words, my husband was very, say, considerate for my breast cancer, because I guess, too, his mother had breast cancer. So, you know, he had at least an awareness of it, and actually his mother died from breast cancer. So, but other than that, I mean, it hasn't. And then too, I don't know. I'm the kind of person. Breast is not going to make me. I mean, I was never voluptuous in the first place. So, what I had is enough to keep me going. And technically speaking, I don't have a, reconstruction. I'm just blank on one side and whatever, but that doesn't take away. I feel, in other words, I feel just as sexy, just as hot, and got it going on. And ain't gonna let nobody tell me I don't have it, because as I said, I know people that technically speaking, tomorrow I'll be 57 years old, and in actuality, I know people that are younger than me, and I look better than them, and I'm not trying to toot my horn, but I am too.
To speak to the point that your husband is still attracted to you,
yes,
and still finds you sexy too.
Yes, yes.
And you know, I can speak
I mean,
to
he'll
that.
He'll say things to me, and you know, hot mama, or he likes how I'm dressed, or you look good, and as I said, and technically speaking, I put myself sort of in that position because I don't want him trying to look no place else. And in other words, if nothing else, I let him know too. I'm just as hot that even if you think you don't want me, somebody out there will want me. So, okay, it works both ways. It works both ways.
That sounds like it has a lot to do with self-image.
It does.
Right. Right. And how you feel about yourself.
How you feel about yourself.
You let somebody tell you, well, I don't know. I just, as I said, the fact that I survived it, I'm blessed. I thank God. You know, I've met a lot of people, and I enjoy the connections that I have from a lot of women that I've met that have breast cancer, because they share their experience, and I guess that strengthens me also. So it's not like you're just, oh my God, you're in this world by yourself. I guess the worst thing I could say for me with the cancer thing was my hair, and I got that back, even though I don't necessarily, I wear like a lot of hats, and I'll buy wigs. As far as for me, my new era of life is I'm not going to chemically treat my hair. I'm not going to put any color. You know, and I'm not at that gray enough level that, you know, I see some women that have their hair is lovely gray. You know, I'm waiting until I get to that point. When I get to that point, then I'll let it hang like that. But other than that, hey, I'm a blonde, I'm a redhead.
But it does speak to your sense of self and your strength about your own image, and that also probably plays to who the partner is that you picked. And if you pick partners who reinforce a negative self-image, then you're going to keep feeling like this isn't working, these guys are only after me for one thing, and I don't have that to give anymore. So I do think it has to do with self-image, and again, I would encourage somebody in that situation to talk to some other people and to get some therapy, some help to help them to move to another place.
And the only other thing I can think of is if the person has reconstruction, just think of them as, what is it, the women that get the implants. You got implants now, you know. Because I'm saying, I don't understand why women, I don't say that it's not my business, you know, whatever, anybody's prerogative. But you see women that they got enough and then they want them bigger. What can you do with that? I mean, and I guess that's from a man's point of view. But it's something to do with, for them, that's not their real thing. And men like to, you understand, to me, if it's not really you,
if you're getting an add-on and people like you, so just, even though you have breast cancer, if you're hopefully you're healthy now and you live a long life, so just consider them implants. Just say, yep, these are my new sisters. They got upgrades or whatever.
And I have a friend who was diagnosed very young, in her 20s, and then diagnosed twice after that, had a mastectomy with no reconstruction, and met a man that she married after cancer. So at least there's one man out there who didn't know.
He wasn't asking for breast,
I have a very recent patient also who met a man in the midst of her reconstruction, and she kept him at bay until the reconstruction was over, and they just married last month. So, and this was a woman who had started to see me beforehand because of issues about not being able to get involved seriously with a man. So this was after cancer, and about a year and a half, 2 years into the therapy, she met this guy. Her reconstruction was delayed somewhat, so that's why it took a while. But I think that there are quite a few men out there who aren't just looking at women just for their breasts. But if you haven't met those men, you don't know they're out there.
Right.
So how do you go about changing this thinking, right? So, I really believe there are no men out there who would want a woman with one breast or no breast. I mean, how do you go about?
Well, it's part of it is therapy. I mean, I would ask somebody, why do you have that idea, and what's been your experience with men in the past, and what was your experience growing up, and what does it mean to have breasts to you, and what are your breasts, or what does that mean for you to have breasts in the context of a sexual interaction? So it would be a long conversation to try and understand where that person is coming from. I wouldn't presume to know.
I think, again, like in my situation, like it was like breast cancer was just part of it, but like whatever I had in the past, this breast cancer amplified all the problem I had because
Right.
I ignored whatever happened in the past. So I think what I'm going through right now is just, it's not only breast cancer or partner or sex life, but it seems like, yeah, everything just...
Right, sort of a post-traumatic reawakening.
Yeah.
Yeah, I don't think that any of these questions are necessarily easy to answer. There's not a quick fix for everything.
There's an observation that I'll make because, the evolution of the internet and online dating, I think some of the best romances, the romances that really develop because of that, start as epistolary romances, where people write about their thoughts, their feelings, their interests, and then they want to meet because they have a lot in common, and there's something about the sense of humor or the intellect that is, sparking a fire. I'm not diminishing, physical attraction, for that, but it's a big part of it. And so if you believe in that, if you believe in soulmates and kismet and, having an interest in somebody that way, there's a great hope that you're going to meet somebody that shares those things.
Right. And you may have to kiss a lot of frogs to find the prince.
Absolutely.
Great.
So I have a question about body image and self-image. Are they the same thing? Are they different? And I have a follow-up question.
I think they're connected. I think self is a little bit broader. Body has more to do with your sense of yourself, your physicality. I think that if you have a really good self-image, then it usually, you may have even if you don't have a great body, you may have a realistic attitude about your body and still have a good body image. But so they're related. They're related. Self has to do more with your sense of your total sense of yourself as a person, and that clearly that gets undermined by suddenly being thrown into a cancer diagnosis and treatment and role. That if you've never been there, it's very unsettling, and so you really have to go back to your resources to get stabilized in terms of who yourself is, and your body image may or may not change during that depending on what you're going through, but your self-image certainly does. And then obviously if you've had surgery or you've had really major changes in weight or hair or other things, it's going to affect how you see yourself. You look in the mirror, you look different. So what's the follow-up?
So we hear, in the breast cancer world, at least we hear a lot about body image in women of all ages. So it's not just younger women, it's women of all ages, and some really have a difficult time kind of moving past that. So what you were talking about earlier, how do I move past the mastectomy? Can you talk about that a little more? So how would you?
So it's hard because women's the images of women are so much about bodies, and they change from era to era, but clearly women aren't given as much leeway in terms of what they're allowed to look like for them to be considered attractive. So we still have to work on that a lot. Women have a lot of issues about their weight, going through puberty for women, going from suddenly having hips that you never had, or a belly that you never had, or breasts that you never had. These are very dramatic changes, and it takes some doing for women to get used to these changes. And I think having a good sexual education growing up so that you know what to expect and that these are normal parts of development can help. But I don't think that most people get that. So even though they know they're going to get their periods, or some people don't know that either, but it doesn't mean that you understand that these things that are going to happen to you are going to change your sense of your body. And then of course there's all the images that are thrown out in advertising of women that aren't real. So the internet, the porn sites and that are used don't convey often real women, and what that women's breasts don't stay perky after a certain point, and it's not that late in life. And so all of these things work against having a realistic image for women. How do you?
So then do men have unrealistic expectations?
So I think a lot of men do, and I think women take on those expectations as well. And so we have to learn to be more supportive of one another and be less critical. And so you have to learn to love yourself as it is. Do the best with what you have. We are not all models. For those of you that can't see me, I'm not even 5'2", and I always wished I could be taller, but I'm never going to get there. I have to stay where I am and do the best that I can. I don't wear very high heels. I'm just small, and that's never going to be any different. And that I'm okay with that. I wasn't always, but I'm okay with that. And all of us have things that we're dealing with with our bodies. The most beautiful model will tell you every flaw on her face and her body that she's looking at, okay? And for some reason, which I don't fully understand, but probably has to do with left brain, right brain, as well as advertising and all kinds of things, men don't seem as concerned about their flaws. Most men are pretty happy with their bodies. Not all, but many. Pretty comfortable with the way that they are. So I think this is a lifelong struggle for women to be comfortable with the bodies that they've been given and to do the best with what they have. We age differently than men. We have different issues. If you have children, your bodies are going to change dramatically. All of these things act to make it harder to maintain a good body image when it's changing so dramatically through different eras of our lives, including cancer.
And someone is saying that she's saying that intercourse is painful for her, and if her husband knew that, she thinks it would be a deal breaker. I mean, this might be a bigger issue than we can discuss here, but...
So I'm not advocating stopping intercourse forever, but I think, again, talking about, the sense of, your sense of self, I don't think most men would be very happy to know that it hurts every time he enters her. I think most men are very upset to think that they are hurting their partners, and they don't want to do that. So now they may say, it's not my fault, it's your fault. But most men, I think, don't feel that way. They feel like, okay, I don't know what I'm doing wrong. What am I supposed to be doing? How do I fix this? I don't think most men want to hurt you. I don't know. What's your experience? Have you ever had a painful sexual experience? Anyone here ever had a painful sexual experience?
And he doesn't want to hurt me.
Okay. Well, as soon as there's pain, what happens? What happens?
You stop.
You stop. Okay. So I think a lot of women try to hide it, and the men, for years sometimes, and I've worked with patients like this, for years the men didn't know because they were naive. I mean, men like to think that they know everything, but they're naive. They don't know what they're doing either. And they didn't know it wasn't supposed to be that way. And you teach them, and they will stop. They want it to be pleasurable to you. They may be thinking about themselves, but they also don't want to hurt you.
Maybe he's doing it in whatever. Well, naturally, I guess he's not. He's doing it in the way that's hurting her because she's not telling him, and maybe he thinks, like, say, if he's doing it in a hard motion or something like that, it's because she likes it because she's not saying it. She said, look, I don't like it like that. Do it a little softer and like it more, I guess. I don't know. As you said, I don't think anybody wants to hurt you. And if you don't tell them, then they don't know. And it sort of stops it right there. You know what I mean?
Right.
You got to know you're doing something wrong before you can stop
I think most men would be more upset that you hadn't said anything, that they hadn't said anything sooner. And again, it gets back to the idea of communicating during sex or about sex to your partner. It's not easy. And so a lot of people have a hard time doing that. I still urge her to try and speak to him.
Right. Well, what about the fear of losing the partner?
So sometimes the end of a relationship can be a wonderful thing. So it's hard to lose somebody, but if you are in a relationship where you are being hurt all the time, where you can't talk, where you don't feel loved, where you feel that the only thing you can do is lie there and take it, maybe, if that's all that's there, maybe that's not a good relationship. So, but I think some people are worried about the end of a relationship, and that's not necessarily where it's going to go. I mean, I think going into couples counseling, getting some sex therapy, maybe there's actually, it can be better. So it doesn't have to be the end of the relationship. And again, I think it's worth trying. It's worth trying to make it better, not staying there and suffering. It has to do with self-esteem, self-image, and with the understanding that your partner probably doesn't know what is going on.
And we could be projecting our own fears, right? They're not necessarily how the partner's going to react or how, it's you thinking that he or she might react that way. It's our own fear.
But even if the partner is upset initially, it doesn't mean that the partner is, again, so superficial as to not want things to be better. That's, the idea that men only look at women's breasts and that's all they want. Yes, of course, breasts are an aspect of sexuality. It's an important aspect for some people. It is not the only thing.
Some men don't even like breasts.
Right.
I mean, my husband really could care less. Like he calls himself an ass man. He's much more interested in women's behind.
Right. So it gets back to the idea of find out what else might also be appealing. And that's, for some men, breasts are important, but they can become ass men if they haven't been before.
It's a clinical term.
That's right.
So, I mean, it seems like there are so many issues that we're dealing with, right? So someone is saying that she and a friend, they're in their 50s, the dating pool is small to begin with. All right, then you add in breast cancer, your own issues, and potential real issues from the men that are out there, and then who you're competing with. And she's saying that a lot of older men are interested in younger women.
That's always been the deal.
Always been the case, right?
Yeah, they got nothing to do with that.
So I mean, one of the things about the Internet that is exciting is that it has opened up the numbers of options out there. There's somebody out there that's going to connect with you, that's going to click with you, and that while a prettier younger woman might turn their head, they're looking for somebody that has a deeper kind of connection to. So we have to get beyond thinking that it's just all about the body. It's not. People of all sizes and shapes with all kinds of physical disabilities and other kinds of issues are meeting one another and falling in love. How are they doing that? Because they're finding somebody that they connect with on an emotional level. And again, we get to, if you connect emotionally and you're not feeling much physically, sometimes that comes later. You could connect emotionally with somebody and suddenly they become more attractive to you. Then you touch. The touch is nice. And you think, all right, let's see. You don't have to make a commitment for forever at that point. You just see. and things move on. I think that there's a lot of tentativeness, understandably, by people that have had cancer or that are worried about the reactions, and so that may put the men off also because they feel like they don't know why the women are standoffish. Maybe the men are thinking it's about them, they don't know. So again, this is a interactive issue, and it takes time. It takes getting comfortable. It takes going out there. It takes meeting a lot of people and finding the one that clicks. And maybe I'm an optimist about this, but I think that if you keep looking, you'll find somebody. And what you're looking for, if you're really not, then you may need to talk with somebody about what are you looking for. Maybe you're picking the wrong people. If you're going after somebody who is very superficial and only looks for certain types of things in people, then you're gonna be found missing something, and that person's not going to be interested in you. Maybe you need to broaden who you're looking for as well. So I still think that it's hopeful and that there are opportunities out there and that everybody can have a better sex life and more intimacy, but it takes work. For some people it doesn't take work, but for some people it takes a lot of work to go and meet the right person and find the right person. And you just have to keep trying. Sometimes there'll be periods where you'll back off and you won't be interested. Fine, do other things. Find your own interests, get in touch with yourself, find the things that you love to do, and in doing that, eventually, you will find someone.
Yeah, maybe when you least expect it. Right?
Well, or sometimes when you're really trying.
Yeah, well, that's true, too. That's true.
I think it's really important that, I'm comfortable about myself, because if I'm not comfortable about myself, I project that, and they don't want to date with somebody who's not comfortable with herself. Like I've been doing, I've been looking for a partner the last 3 years. It's not easy, but I definitely sense that. Like when I'm not feeling well about myself, I meet somebody that's not going to work. But when I'm feeling better, then so that's why I'm trying to take care of myself first.
That's right. And do the things that you love to do so that you get more from life than just from a partner, but also from doing the things that feel good to you.
And I have numerous friends. I was diagnosed young, so I met a lot of young women, some who were partnered at the time, some who were not. And, and over the course, it's been many, many years now, they've had, many relationships. They've met new people. They got rid of the old people. They have found men. They have found women. I mean, it's, people are out there. But someone's talking about, losing her confidence. It has to do with what you're saying, right? It's how you feel about yourself is a huge part of it.
Well, I think also if you're, if you have access to a broader group of friends and support, so the Young Survivor Coalition, SHARE, and just meeting people who are in different circumstances. If everyone around you is coupled and you're not, it's hard to be the one that is the third wheel and is always going out there. You've got to find some other people that are in your same circumstance so that you don't feel like you're the only one. And there are these great meetup groups all over the country that you can start them yourself and find other people that are in a similar circumstance so that you have, sometimes you need that bolstering from your friends and family and support networks to help you get back on the horse again. After it can be very, very hard to do that. You get disillusioned. You have to leave it for a while, and then you get back. You get back. So it has to do with confidence. It has to do with being disillusioned. It has to do with it's tiring. You do need other ways to get back at it, to keep trying different avenues.
Anyone else?
You good?
All right.
Thank you again.
Well, thank you all. Thank you, Dr. Schiffman. It was really an interesting presentation. Took a lot of notes.
Press was good beer.
I'm handing out the cigarettes now. Those of you online who can't see. So people online, if you wouldn't mind filling out an evaluation form, it'll pop up as soon as the webinar ends. We'd appreciate that. And we hope to see you again on a webinar here in person if you happen to be in New York. So thank you so much. Thank you all for attending.
Thank you.
Thank you.